The delegated activity of urinary catheterization, case scenario. The acute shortage of advanced nurse practitioners, APNs, in the U.S. requires the delegation of routine tasks by the NPs, nurse practitioners, to assistant personnel. To ensure high-quality health care and minimize the danger of the procedure for the patient, the NP must adhere to strict regulations of the delegation process. The success of the delegated procedure depends on the rules and responsibilities of the NP, task-related resources and considerations, as well as the monitored process and timely evaluated outcomes of the intervention. In this scenario, the NP is a delegator, while the RN, registered nurse, is a delegate. Due to the understaffing of the healthcare personnel, the NP delegates the task of urinary catheterization to the RN, his subordinate. Bob is a geriatric patient who currently resides in the retirement facility and needs intermittent catheterization every 3 to 4 hours after developing acute urinary retention. For timely urinary management, routine bladder catheterization is advised for Bob until he recovers from the symptoms of acute urinary retention. Before delegating the task to the RN, the NP has to follow a set of predefined clinical guidelines to ensure the safety and comfort of the patient. According to the rules of delegation, a delegate has legal permission to perform a particular nursing procedure that exceeds their current job description only if the supervisor formally allows it. The delegated task should be within the parameters of the RN's scope of practice. The NP maintains full accountability for the patient's health condition despite the precedent of the delegated activity. The NP cannot legally delegate an activity that incorporates nursing judgment, clinical reasoning, or critical decision-making. In other words, the advanced nurse does not delegate the entire nursing process but the part of the process or a specific task. The scope of the NP's responsibilities includes identifying a nurse leader, developing delegation procedures and policies, promoting a positive culture in the work environment, and periodically assessing the delegation process. The responsibilities of the advanced nurse practitioner are formed according to the 5 rights of delegation. First, the NP should choose the right task that falls within the frames of the delegate's skills and does not contradict the established procedures of the nursing setting. Second, the delegation should be executed under the right circumstances when the patient's health condition is stable. In case of a sudden change in the patient's condition, the NP must stop the delegation process and reassess the situation and the appropriateness of care as soon as the RN reports the issue. Third, the NP should ensure that the delegate is the right person who possesses the relevant skills to perform the delegated activity. Fourth, the delegation process should be accompanied by the right directions and specific communication. The NP has to provide particular instructions and maintain two-way communication with an opportunity for the RN to ask clarifying questions. Finally, the advanced nurse has to exhibit the right supervision and evaluation, monitoring the delegated task and assessing patient outcomes. To ensure safe delegation, the NP should consider the RN's professional competencies and a demonstrated scope of nursing practices. If the subordinate does not have the needed expertise, the NP has to provide educational resources and hands-off training for proper bladder catheterization. Brochures from the Royal College Nursing, American Academy of Pediatrics, and bladder and bowel community can be utilized to explain the procedure in detail. Before the delegation, the RN should be fully informed about the patient's health history and physical and mental condition. A nurse-patient relationship should be established before medical intervention to promote an individual approach to treatment. Other people who may be included in the delegation process include, but are not limited to, nursing associates and healthcare support workers. Once the patient's health condition is stable, the task of recatheterization can be delegated from the NP to the relative or carer, provided they possess the relevant competence and knowledge to manage the drainage system. Before the delegate can execute the assigned task, the NP has to confirm the RN's understanding of the procedure. To confirm the RN's understanding of the instructions, the NP can ask direct questions about the delegated task and ask the subordinate to restate the instructions in his own words. The RN can also be requested to provide a step-by-step plan for reporting to the supervisor in case of emergency. The delegated activity of urinary catheterization should be closely monitored during the RN's shift and checked for completion every 3 to 4 hours as recommended by the health practitioner. The completion of the task can be checked verbally with the RN or de facto by the NP. Follow up with the RN at the end of the day and feedback from the patient, assessing pain or concomitant symptoms, are crucial in determining the success of the bladder catheterization. In terms of clinical signs, the amount of urine collected in the container by the end of the day should be considered.